Hi, I'm Mary Bird with Beyond the Crown Veterinary Education. I'm an RVT and a VTS in dentistry. I'm going to talk to you today about two blocks that I use quite frequently as pain management for my dental patients who are having a painful dental procedure done. The reason I love blocks is that I can go ahead and administer a local anesthetic to go ahead and help prevent that pain and block the pain so I don't have to keep cranking that anesthesia up and have the animal at such a deep level of anesthesia. The first one I'm going to talk about is actually the middle mental block. I rarely use this because it can be very difficult to palpate. The middle mental foramen is right below my second premolar, and it can be very difficult to palpate. And sometimes the frenulum on the animal is just so thick it can be very difficult to do. So there's two ways we can approach this. We can come in straight into the foramen. Again, I only go to the very edge of it. Or I can use my canine tooth as kind of a anchor or a brace and just go right into that area. I just go ahead and aspirate to make sure I'm not in a blood vessel, inject, remove my needle, and digital pressure and a little gravity to go ahead and help block this. This will only block my canines and incisors. So the block I do most frequently on my patients will block the entire mandible on one side. Now there's two ways we can do this mandibular block. We can go ahead and do that as an internal one or external. I prefer the external because it's a little safer and less likely that the patient might go ahead and chew their tongue because their tongue is numb. So I'll take my finger, put it into their mouth, and usually if I have the whole dog here, I could go ahead and drop a plumb line from the corner of the eye down. And I have my finger in there, but what I will actually do is you can sometimes strum the nerve, but I'm going to come in with my needle underneath the gum and just go up. I have my finger in there so that I know I'm on the medial aspect of the mandible instead of here. So I'm going to go in, again, aspirate once just to make sure that I'm not in a blood vessel, inject, pull away, and go ahead and use digital pressure and allow that to go ahead and numb that nerve as it works down into the mandibular canal, blocking the entire quadrant.